You ever feel like there's so much air trapped in one or both of your ears? It feels like someone shoved a balloon in your ear and started blowing it up. You feel cloudy, this off balance sensation. You just don't feel like yourself. A lot of you are struggling with this daily. What if I told you that a lot of what you're dealing with right now in your ears could be stemming from your dental care or a lack of? You could be having problems with one or more of your teeth, causing this irritable sensation in your ears that just does not go away. In fact, when you go to the doctor's office, you're only given medication that treats allergies or treats what may or may not be going on with the ear. Some of you are on extreme medications like prednisone, where it's trying to reduce swelling, that it's just going to keep happening, it's going to keep developing, because guess what? The teeth has a major influence when it comes to trying to deal with problems with the ear. And in fact, the longer you keep trying to figure out what's happening, you're going to start developing stress. That stress is going to start turning into the anxiety. The anxiety is going to start turning into depression. That depression is going to start turning into panic. That panic is going to start turning into more doctor's visits. And that's more times of being told what or what isn't working. Because our teeth has a major influence how we feel in our ear. And if you haven't been told that, how would you know? Dental infections or abscesses are very common when it comes to having issues with the ear. In some cases, a dental infection or abscess can spread to the surrounding tissues and cause inflammation or pressure on the eustachian tube. The eustachian tube is located near the roots of the upper teeth. In some cases, dental problems or procedures can affect the surrounding tissues and potentially impact the eustachian tube. Now, I was also dealing with jaw problems. Now, that's another thing that we need to cover here today, TMJ. When you have issues with the structure of the TMJ and the structure of the jaw in general, this can stem and really exacerbate a lot of issues to that eustachian tube, causing problems with your neck, your shoulders. That's why a lot of you that are dealing with this, you feel tense around your neck region. You just feel like trying to turn. You feel this like resistance. You feel this tight band pulling on your shoulders and your back. And then that is going to start developing the emotional side of things, because now you're going to start thinking something is further wrong with you that had originally stemmed from the ear, which goes into now the muscles, the surrounding muscles, the chest muscle, the pectoral muscles. So what happens is now you start thinking you're going to have an episode, maybe a heart attack, or you're going to have some kind of major life crisis happen on you. And the more you start generating those thoughts, and the more you start embedding these feelings and these symptoms, you're going to start thinking more things are wrong with you. This is going to not only prompt you to think that you need to go have more advanced testing done, you're going to feel worse when the symptoms don't go away after those testing is done. So that's why it's so important that the anxiety is in check. Stress needs to be lowered. The cortisol levels need to be at a very lower level. When we first wake up in the morning, our cortisol levels are at its highest. And so when we try to maintain our lifestyle with this problem, we're doing all the things are outside of what's really happening. So when you have problems with your teeth, specifically maybe a molar growing in, you may have your wisdom teeth growing in, or they already in, and some of them are still trying to come in. You can put a lot of advanced pressure on that eustachian tube. Like I mentioned before, tension in the jaw and facial muscles can cause the eustachian tube to become even more blocked or dysfunctional. Inflammation or infection in the dental or facial area can spread to the eustachian tube and cause dysfunction. And there's something called nerve stimulation. The nerves that control the eustachian tube are located in the same general area as the nerves that control the teeth and jaw. In some cases, dental issues can stimulate these nerves and affect the eustachian tube. I can't stress how important it is to be in touch and stay on top of your dental care, because it's these little things that just go over our awareness that we could be causing more harm than good. In fact, as you begin and continue to use those medications that you think may or not be helping, it could further position you in a spot where it's not helping you heal, it's actually putting you more in a delinquent state. That medication that you're using, thinking it's treating what you're going through, is not only causing more anxiety, it's raising the blood pressure, it's causing you to be irritable, it's dehydrating you. All these things are a very crude recipe to having more problems and to prolong this issue of Eustachian tube further. So remember, folks, your dental care, stay on top of it, get in touch with your dentist, explain to them what's going on, explain to them what may be causing the problem. Sometimes you have to actually bring this issue out into the forefront because it's not going to get brought up if you don't. Sometimes you're going to have to tell them, hey, I've done a lot of research here. I've had to really dive in. I've saw A&T. I've done all these different things. So please guide me in the right direction and look back there and see what could really be causing my problem, because I've already tried and I've exhausted myself. So I hope this video very much helps you. If it does, please take time to subscribe to the channel. I try to bring content as often as possible. But in the meantime, I'm going to step out of the Jaye studio and leave you in good hands with this video. Like anything else, folks, we're here to simply go back to the basics. Take care, everybody, and I will catch you in the next video.